Heim. She's the president-elect of the American Academy of Family Physicians. Dr. Heim advocates on behalf of family physicians and patients nationwide to inspire positive changes in the U.S. healthcare system. The American Academy of Family Physicians is one of the largest national medical organizations with more than 93,000 members. Welcome.
Thank you, Chairwoman Velasquez and Representative Graves and members of the Small Business Committee. I am Laurie Heim, President-elect of the American Academy of Family Physicians, which now represents over 94,000 members across the U.S. And I'm pleased to be here to testify on physician workforce needs as Congress considers health care reform. As you know, the vast majority of family physicians themselves are small businesses, delivering care in communities across the nation. Nearly 38% of family doctors practice in solo or two-physician practices. And studies indicate that more Americans depend on family physicians than on any other specialty. We see up close the hardship of the uninsured, and we struggle along with those patients who are insured but then who face coverage denials. We consider an expanded primary care physician workforce essential to the success of health reform. Unfortunately, while the supply of primary care physicians is far from adequate, the projections are truly alarming. Primary care has been described as the base of the healthcare workforce pyramid, but the U.S. physician profile is only 31% primary care and 69% specialty. The FAAFP supports the steps necessary to build the primary care workforce to at least 45% of all practicing physicians. To restore stability, we must adopt workforce policies that ensure an adequate number of primary physicians who are trained to practice in the comprehensive patient-centered primary care medical home model. That model of care provides patients with preventive care as well as coordinates their chronic diseases and appropriate care for acute illness. To realize the quality and efficiency benefits of the patient-centered medical home, we must have an adequate supply of primary care doctors, particularly family physicians. The reasons for the inadequate supply of primary care are many, and we must address each one of these. The first and most critical step has already been mentioned, and that is to increase the payment for primary care. This will encourage more student interest in primary care, as well as allow for the redesign of existing practices to improve quality and access. Next, Congress should provide targeted incentives, such as scholarships, loan forgiveness, or other forms of debt relief for medical students who choose primary care and family medicine. Also, we are recommending opportunities in programs such as the National Health Service Corps. Congress should reauthorize and adequately fund Title VII health professions training grant programs for primary care medicine. AAFP has also called for reforms to graduate medical education payments to ensure that we are training the primary care physician workforce that we need. However, we would suggest caution with respect to the expansion of residency slots. We recommend that unused residency slots be dedicated to primary care before an overall expansion of the number of residency slots is considered. We are grateful to the House discussion draft that it addresses the primary care physician workforce shortage with the provisions including the bonus payment for primary care services provided in health profession shortage areas, reauthorization and mandatory funding for Title VII, Section 747, the Health Professions Primary Care Medicine Training Program, and the National Health Care Workforce Commission to study and recommend appropriate numbers and distribution of physicians. We look forward to continuing to work on workforce and other key elements of health care reform. Now is the time to provide affordable, high-quality health care coverage. The status quo is not working, neither for the physicians nor for the patients. We urge Congress to invest in the health care system that we want, not the one that we have now. Thank you very much.